Good afternoon and welcome to Marquis Presents Your Key to Healthy Living. My name is Karen Halloran and I will be your host. I'm the Community Liaison for Marquis Health Services. Today we have Maureen Brancato joining us, and she is from Compassus Hospice. So welcome to the show, Maureen. Thanks for joining us.
Thank you so much for having me. This is great. So I am a certified hospice and palliative care nurse and the clinical liaison for Compassus Hospice and Palliative Care. And I'm glad that you asked me on the show today to talk more about pain management, because didn't you say it was Pain Management Month?
It is. February is known as Pain Management Month.
And it's such a topic that is near and dear to my heart because I feel like pain is grossly undertreated in the U.S. For instance, I think chronic pain is the #1 adult disability in the United States right now.
It is.
It is. It's crazy. I mean, over 50 million people in our country experience it, and I think it's due to inadequate pain education and management in the medical field.
So besides taking actual medication, there's a lot of different things that can be done to help with pain management. So maybe we talk a little bit about some of those things.
Yeah, I think that pain is so individualized that the treatment needs to be multifaceted. So, obviously we have medications that help, but also, non-pharmaceutical things such as equipment. Even just something in your chair that you're sitting in every day could be a cause of pain. Also, meditation and massage. Yes, so there's different things. The chair that you sit in every day could be a cause of pain. Also doing stretches, things of that nature. Music and aromatherapies are a really good way to help meditate and get yourself to a comfortable level. And massage is a really big one.
That's great.
Yeah, there's a lot of different techniques.
These are the different services that if somebody went with Compassus, these are the different things that you would be able to offer.
Yes. And, that kind of brings me to our palliative care program that we have, because it kind of encompasses all of that holistic approach we were talking about. Whether it be, go ahead.
I'm sorry, it's hard going back and forth. If you could just explain what palliative care is, because I think sometimes people don't understand and they see hospice and palliative as the same thing.
Absolutely, yeah, and that's a common misconception. Palliative care is for patients with life-limiting illnesses, such as, cancer, CHF, Alzheimer's, COPD, but it doesn't necessarily mean the patient has to be dying. They just have to have that life-limiting illness. And palliative, the philosophy is just focusing more on comfort and symptom management. The goal is to really improve the patients and their families' quality of life for as long as they're alive. So it's not necessarily, end of life type stuff.
Right. Because I think a lot of times when people say hospice, they look at it as like a death sentence. That's it. It's over. And us in the industry, we know that that's not always the case. A lot of times people can graduate from hospice. So it's not the death sentence that maybe it was assumed to be before.
Yeah, absolutely. And I feel like now hospice isn't what it was even 10 years ago. We try to bring people on as early as possible so that they can benefit from the services and the support that we provide. So yeah, I agree. I think people's perception of hospice is, end of life, laying in bed, dying. And, that's not the case sometimes.
Right. So bringing us to palliative care, when you go into the home, say somebody wanted to sign up, let's start from the beginning. How would somebody figure out, if it wasn't a referral from the hospital or a doctor, they decide, well, my loved one's at home, I don't know, it's looking like it's the end of life, should we contact hospice? How does that look? How do they go about to get a referral and even find out what company to use?
So I always say just call us, or even do a quick Google search for hospices. But call us, talk to your doctor about it, but you can always advocate for yourself and make the referral yourself. So typically what happens is in the palliative process, we would have to get the doctor's order to evaluate, which the patient wouldn't have to worry about. That's something we coordinate. Then our nurse practitioner would go out to wherever the patient calls home. So it could just be their residence. It could be somebody in a nursing home, assisted living, kind of all of the above, wherever they reside. The nurse practitioner would do a head to toe assessment. She'd look at medications, review them, review the medical history, and then she'd make recommendations to the primary care for those changes. Mm-hmm. And it's important to know that it's not just medication changes. We, like I said, look at the whole picture. So it could be, you know, maybe she recommends a different chair or cushion for you, or it could mean that she's recommending a consultation with a different clinician or oxygen. You know, it's not just pharmaceutical measures. We're looking at the whole person and the whole picture.
That's fantastic. I know so many people that have benefited from it. So I'm definitely an advocate for hospice and palliative care.
Good. Yeah, absolutely. I feel like it's such a, once you hear all of the support you get, it's amazing. And most people say, sign me up.
Exactly. Now you're located in North Andover, correct?
Yes. So our office is in North Andover, but we have offices throughout the state. We have one in Auburn, one in all over New Hampshire. And our North Andover office covers everywhere from Ayer to Boston. Mm-hmm. So we have a big territory.
If you had to say what you did differently in your hospice company at Compassus, there are a few, you know, a bunch of other ones. What do you do a little bit differently?
I always say that our company is a national company. We have over 165 offices throughout the United States. But when you call our office, it feels like a mom and pop. Everyone, like Cheers, where everyone knows your name. So I think that's really what sets us apart, is the individualization and personality we put into it. We look at our patient as a whole. And I think it's important with palliative care that you get the services as soon as possible. And I think sometimes there's a delay in treatment with other places. And I feel like our turnaround is 4 hours, where we can start setting up an appointment at that time. So we're pretty quick to deliver.
That's awesome.
Yeah. And I think it's important to talk about like what makes somebody hospice eligible, because I think a lot of people don't realize, you know, they look at their loved ones and they're like, oh, they're not dying. But it's not necessarily looking at if they're dying or not. It's looking at the declines that they are having in a certain amount of time. So typically for hospice, we look at several clinical indicators. We look at weight loss. Like, is your loved one, you know, were they eating 100%, you know, in the summer, and now they're only taking small bites? And have they lost a lot of weight? Are their shirts not fitting? We look at functional declines. Maybe they were walking and now they're using a wheelchair, or they're bedbound, or they didn't need any help in the shower, and now you need to go in there and help them. Right. And of course, incontinence, you know, if somebody was fine before and now they're incontinent. And then we also look for rehospitalizations and infections. So if somebody's been in the hospital and they had several UTIs, all of those things kind of paint a picture for us of decline. So that's kind of what we're looking for a hospice candidate.
That's great.
Yep. Yeah. And I think it's, you know, for hospice, I think the benefit of it is typically it's a Medicare benefit. So it's free, essentially, to somebody. They're always asking, you know, what's the out-of-pocket cost? And typically it's nothing for our services. It's through Medicare. We provide in the home equipment that you may need, like a chair, a hospital bed, a shower chair, things of that nature. We have a nurse that comes out and checks on you. Typically, we start off with, weekly or twice a week, but it can increase as things start to progress. You get a home health aide that comes 5 days a week that helps with, care in the morning. Sometimes that's difficult for family members to provide. And then also certain medications that would be, associated with their terminal illness.
Right.
And also just the support of, social workers, chaplains, a lot of people to support the patient, but also, the family as well.
Yeah, I just had a girlfriend whose father was passing and referred them to hospice, and they couldn't have been happier. I mean, it was just fabulous for the family. The extra support that people get, I think a lot of times they're just really afraid of hospice, the whole word, but once they do receive the services, it's just fantastic. It's helpful for the whole family. I'm sure you do that.
Absolutely. I think it's just the misconception of the word hospice. I was talking to a family member the other day and I said, let me describe to you all the benefits you're going to get, and then I'll tell you what the word is. And, they were blown away. Hospice is not just bedbound and, days to live. We're really trying to get in there early enough to provide the services and, have people benefit from it.
So why do you think that doctors don't, make a referral all the time? A lot of times the doctors are not saying anything. I wonder what that's all about.
So many different reasons, I think. I think it's a lot of education. I think doctors are really great with patients that are living and that they can treat. And I think they start to just, get mind blown when, this medication isn't working and there's things that just aren't working. And I don't think they necessarily want to give up, is what they say. Right. But, hospice is not giving up. It's just a different type of hope. It's a different type of hope. We're hoping for comfort and to keep this person, if they want to stay home and they don't want to go to the hospital anymore, that's the kind of hope that we're helping with.
Right.
But I definitely think it's education for clinicians. I mean, a doctor could be a doctor for 30 years and not know much about hospice and end of life. I actually just had a doctor the other day. I was talking to him about end of life COPD, and he goes, "Oh, I didn't even know that."
You can educate them.
Yes, yeah. So I think it's just education. I think sometimes it's hard because they don't see them a lot, especially nowadays during COVID. It's telehealth,
right?
So it's hard to really assess the situation at home and kind of bring the picture together. So that's why I always say to families, if you're seeing these declines, bring it up to the doctor or call us and we'll bring it up to the doctor. Because I really think in this day and age, you have to advocate for yourself and your family.
I believe so.
Absolutely.
So what are some of the other things that you offer? I mean, you had said, I didn't hear about music therapy. I know you offer that. Aromatherapy.
Yes. Aromatherapy. We actually offer pet therapy, which is huge. It's really huge. We have a cat named Hamilton. Shout out to Hamilton. So cute, big fat guy. And it's really good, especially for patients in nursing homes that haven't been able to have their pets or see them, that are big pet lovers. It's nice to bring those into them and, be able to let them spend time and pet them. So I think that one's really huge to me. We do have music therapy and aromatherapy. Sometimes it's just as simple as, one of our home health aides has this wonderful hand lotion and she gives hand massages to our patients. And I think even that sense of touch and massage and the smell, it just brings a sense of comfort. Yeah. So I think those are really important things that, we bring to the table that aren't necessarily medical. It's more like we call it the hospice heart, right? It's something that we do extra that is important to the patient, so it's important to us.
I've seen it work firsthand. You know, I've seen so many happy families and clients, so I can't say enough about it.
That's awesome. I'm really glad to hear that, because I know that people do have negative connotations when it comes to hospice, but it's just most of the families that I've come across after we are able to sign them on and admit them, they are so thankful that they joined us, because, you know, we also, you know, once the patient passes away, we have services, bereavement services for their family. So we follow them too. In hospice, we like to say like the whole family is our patient.
Right.
Once the patient passes away, the family becomes our patient. So, you know, we offer bereavement groups and check-ins all the time.
That's fantastic. I have a personal experience that my uncle passed and he was in hospice. He was at the hospice house and everything, and they did have a ceremony for like everybody at the end of the year that had passed. And it was really comforting for my family. So I'm sure it would be really comforting for a lot of people out there.
It is, and we provide that too. And you know what? It's just as important for our staff, believe it or not, because, you know, we are with you guys every day, and we're, you know, dealing with you, the grief.
Right.
So it's really nice. I mean, sometimes during ours, we'll have the nurse go up and tell a funny story or a nice heartwarming story that happened with the patient. And it's just a nice way to grieve together, you know, family members and, you know, the people that took care of them.
Right. Well, you are definitely doing God's work. All of you are. It's not an easy, you know, business to be in, but I'm sure it brings a lot of joy. I mean, just me working in long-term care, I couldn't imagine myself anywhere else. So I think it is very rewarding.
Yeah, I think that there's a certain aspect that draws people to hospice, whether it be a personal experience or just the hospice heart. But I do think it takes a special person and a special nurse or aide or social worker, chaplain. But it does take a very special person to be in this field. And I think our clinicians do a great job.
But I guess what we want all of the viewers to know here is do not be afraid of hospice or palliative care. Do not. It's a really good benefit that you've already paid for, basically, with your insurance. So it's free of charge. You're going to get some help. I guess I would ask anybody, you're going to put your information will be at the end of the program to reach out and speak to you about it and not be afraid of it. And if they have any more questions, that you could answer them for them.
Yeah, I definitely think that even if there's a question, you know, maybe my mom is declining, I'm not really sure. Maybe she's not meeting these clinical criteria that Maureen spoke about today, but she is declining in other ways. It's totally fine to reach out to us and we can talk it through. Maybe the patient or your mom or whoever it is might not be eligible for hospice, but we do have a program called the Connections Program, which is for patients who aren't necessarily eligible or aren't ready sometimes for hospice. But we follow them and we check in and we do goals of care conversations with them just to keep in touch and make sure that they feel connected and that we can help them in some way.
That's wonderful. That's really nice.
So I say if you have an inclination to call, absolutely call, and we can figure out where you fit into the hospice family.
That's excellent. Okay, well, I guess you've given us a lot of information about hospice and palliative care. I want to thank you for coming on the show. It's been a pleasure to have you on today. And we'll put up your information at the end. And if anybody has any questions, we'll take it from there.
Awesome. Thank you so much, Karen. I appreciate this time. And like I said, anyone has a question, give us a call.
Fantastic.
Thanks so much.
Thank you for coming on the show. And thank you for tuning in today, everybody. We will see you the next time and stay safe and healthy. Till next time. Bye-bye.